It's 12:05. I think we can start. Kirsty, can you give me the thumbs up? Yeah. So hello, everyone. Thank you for attending this webinar organized by the Canadian Association of Midwives. My name is Astrid Bucio, and I have the pleasure to be your host for this event. I would like to begin by acknowledging that the land from which I will participate in this webinar is on the traditional unceded territory of the Algonquin Anishinaabe people. The Algonquin people have lived on this land since time immemorial. Before we start, some housekeeping details. You are all muted to ensure that we don't have problems with the sound. This being said, if you have questions for the panelists, you can write them in the chat box. We will make note of your questions and answer them at the end of the presentations. This webinar will last 1 hour. If time runs out, we will write to you after the presentation with answers to your questions. And we will also share with you the policy brief in French and English by the end of the week. So CAM is a young association having just celebrated 20 years of existence. And despite this short life, the association has developed an interesting expertise in the field of organizational development, which she shares with sister associations here in Canada and around the world. She works closely with the National Aboriginal Council of Midwives, NACAM, and 13 other professional associations across Canada, which together represent approximately 2,000 Canadian midwives. CAM has also been working with associations outside of Canada since 2008 through the establishment of partnerships that emphasize equity, respect, accountability, and reciprocity of benefits. CAM and the associations with which it collaborates have together gained experience and developed valuable expertise, both in organizational and technical fields. CAM has also been fortunate to collaborate with two researchers, Kirsty Bourret and Cristna Mattison, who have been studying the process of organizational strengthening of midwifery associations in which is involved CAM. They are here with us today to present results of their investigation. Dr. Kirsty Bourret is a registered midwife and adjunct scientist at the McMaster Midwifery Research Center and was a Francophone faculty member with the Midwifery Education Program at Laurentian University. She is a health policy and systems researcher in sexual and reproductive health and rights, engaging in activities to mobilize research evidence to inform pressing international policy issues. Specifically, the role of midwifery associations in advancing the profession of midwifery and the role of midwives in the provision of comprehensive abortion care. Dr. Cristna Mattison is an adjunct scientist at the McMaster Midwifery Research Center and an assistant professor at McMaster University. She uses health policy and systems approaches within research in sexual and reproductive health and rights. Specifically, her research agenda focuses on building a better understanding of the role and integration of midwifery in health systems. Kirsty and Cristna ground their work in collaborative approaches to research and anti-colonial and feminist lens and work with midwife researchers in the Democratic Republic of Congo, Tanzania, South Sudan, the Somali region, Haiti, and Canada. So I pass the micro to them.
Thank you, Astrid. We are thrilled to be here today and to have this opportunity to host this webinar and present to everyone on our research on midwifery association strengthening, their role, midwifery association's role in supporting the profession, and really that ultimate goal of improving sexual and reproductive health and rights. So I'm Christina, joined by lovely Kirsty, and we will walk you through our research. Everything's clicking well. You're seeing thumbs up. Good.
Yeah,
okay.
Thumbs up. So thanks again, everyone, for coming. This policy brief that we're presenting today is based on our original research, where the goal was to determine the best practices for strengthening midwifery associations and to create a conceptual framework. This research was in partnership with CAM and supported by the MyTax Accelerate internship program. Before we begin, we really need to thank our research team and co-authors in our research publication, Emmanuel Hébert, du Canada, Sabalda Lashabari from Tanzania, Ambroka Kabea from the République démocratique du Congo, Chika Patrick from South Sudan, and Jamie Robinson and Liz Darling from Canada. We'd also like to thank the participating midwifery associations who also vetted our results and framework. So l'Association d'Infirmières Sages-Femmes de Haïti, South Sudan Nursing Midwifery Association, Tanzanian Midwifery Association, Société Congolaise de la Pratique Sage-Femme. A note that our research was conducted in both English and French. So while our presentation today is only in English, we are running the same presentation in French on May 25th. However, I am able to answer questions in both French and English. Il est à noter que notre recherche a été menée en anglais et en français. Alors que notre présentation aujourd'hui est en anglais, nous sommes vraiment heureux de répondre aux questions à la fin dans les deux langues et nous aurons une présentation complètement en français le 25 mai.
Any Spanish speakers on the webinar as well? Podemos hablar en español también. So before we get to the main content of the presentation, we wanted to take just a minute to position the research and the policy brief. So what Kirsty and I did is we led this multi-country mixed method study, and this was over 2019 to 2020 in collaboration with CAM. And kind of there's three overarching aims of the research, which we'll explain in greater detail later on, was to synthesize multiple sources of evidence, to understand the factors that influence midwifery association strengthening. Then we wanted to use the example of CAM's programming related to supporting civil society organizations to understand the factors associated with midwifery association capacity building. And lastly, to develop theory and concepts for midwifery association. And this led to this overall purpose of creating a framework for evidence-informed midwifery association strengthening so that midwifery associations can leverage the impacts of midwives to improve sexual and reproductive health and rights.
So it's actually from these research findings that Christina just described that we then developed a policy brief that we're presenting on today. So this was actually part of the International Policy Ideas Challenge, which was hosted by Global Affairs Canada, or GAC, in which we were award recipients and had the opportunity to work with GAC to inform their international policy agenda. While our presentation today is focused on that policy brief, we think that our findings and recommendations will be broadly applicable, and there will be elements that can be used by all of our participants today.
A note to say that, as Astrid mentioned, you will have everything that we've done is publicly available in English and French. So you will have access to these resources. Alex will also likely drop it in the chat for you. So really the point of our session today is for you to sit back and relax and listen to the presentation and hopefully have a good conversation afterwards. But here's the information of everything that's available. You will get an email package with the policy brief, and exciting to announce that our journal article on this research is in press right now with BMJ Global Health, also in English and in French, and will be widely available hopefully by next week sometime. So to ensure that we're all on the same page, we wanted to start off with defining some core definitions that will be throughout our presentation and our policy brief. Let's start with midwifery, the most obvious one. So this definition is really important because many projects claim they are training midwives, but often provide substandard trainings that are not equivalent to international or country standards. So according to the International Confederation of Midwives, the ICM, a midwife is a person who has successfully completed a midwifery education program as defined by the ICM and global standards and is recognized in their country. They have also the requisite qualifications to be registered and or legally licensed to practice midwifery and use the title of midwife. Then we have midwifery associations. Midwifery associations are the national professional organizations representing midwives and the profession of midwifery in their respective country. They are an example of mostly women-led civil society organization. Leads us to civil society organization, CSO. Here we really adopt the broadest conceptualization. This is put forward by the United Nations Research Institute for Social Development. And broadly, it includes that full range of associations. So they can be professional associations like health profession associations, trade unions, cultural or religious groups, and so on. And then lastly, we have sexual and reproductive health and rights. And here we also use the broadest definition and components for SRHR from the Guttmacher-Lancet Commission's report on SRHR from 2019.
Okay, so a few points on why midwifery associations are so important to strengthening midwifery and ultimately SRHR. And this is supported from our research findings. So number one, they lobby for overall integration of the midwifery profession or midwifery services into health systems. Number two, they lead, oversee, and monitor standards of midwifery care or practice, advocate for their members, and ensure accreditation mechanisms are in place for midwifery education programs. And three, midwifery associations uphold the human rights of women and children, pregnant people, champion for broader SRHR issues such as female genital cutting, gender-based violence, and access to care during conflicts.
So while we know that midwifery associations, they have this critical function, they also face barriers to engaging in policymaking. This is due largely to the disempowerment of the profession, which is driven by this intersectionality of gender, sociopolitical, professional, and economic factors. And it becomes quite evident then why we need to properly support midwifery associations in capacity building in order to have a greater impact in their own country context. So like we mentioned, we conducted this large mixed methods study. It was a qualitative evidence review and synthesis, more specific, it's called a critical interpretive synthesis, big word. But what we did was to look at it to determine best practices for midwifery association capacity building. So in addition to doing the systematic review, we collected, as you see here, 4 other types of qualitative data.
So the map on this slide highlights the countries in which CAM has been or is currently engaged in projects with midwifery associations. So it's within these contexts that we conducted, you'll see key informant interviews, focus group discussions, observations, and documentary review. So you can see that the research spans a range of contexts and that we collected lots and lots of data to inform our findings.
So here we'd like to take a brief pause before we get into the research to position our research and our policy briefs key findings within the broader literature on the roles of midwives in health systems so that we can more clearly outline the health system impacts when we strengthen midwifery associations. So if you look to the green triangle, here we have the enabling at the bottom, the enabling political system factors. So think of these as institutional factors. So those would be policies and legacies around policies that value midwifery as a profession. Interests are collaborative interest groups. So say midwifery associations, obstetricians and gynecologist associations, nursing associations, coming together to reach a common goal. And ideas that relates to societal values and societal norms. So here they would be centering on gender equity, birth as a natural process, and supportive research evidence. So they come together and they act as enablers to the health system factors, the health system's arrangements, and they build together, as you can see, to support the integration of midwives in health systems.
So when combined, supportive political and health system factors lead to health systems where midwives are practicing autonomously and improving the quality and safety of SRHR. So our research findings show that when midwifery associations were embedded into larger projects, so larger funded projects, such as by implementing partners, there was a positive relationship between supporting the capacity building of midwifery associations within these projects and the integration of midwifery and health systems. So, for example, our results showed that midwifery associations advocated for and improved how midwives were deployed in the system. If midwives were appropriately positioned, so rather than filling nursing positions, but they were filling midwifery positions, their skill mix, so their role performance, the expansion of their scope, or working in interprofessional teams. 4, the availability of and timely access to midwifery care, so that's workforce supply and distribution. 5, how midwifery care is provided, so ensuring their members were providing evidence-based, respectful midwifery models or SRHR services. And 6, where care is provided. So that's like the site of the health service delivery, the actual physical structure, and if equipment was readily available, even simple things like water or electricity.
Finally, our research results showed an increase in women's participation in leadership and decision-making. So for example, capacity building of the association resulted in more women in leadership positions within and outside of the organizational structure. Participants described new leadership opportunities to advocate at policy and practice levels. This included midwives being invited to represent their association at policymaking levels or to train and work with other decision makers at all levels of the health system. So examples of this include being invited to produce new guidelines on COVID and pregnancy, to speaking to health managers on the role of midwives in health facilities, to meeting with ministers to advance legislation related to midwives. This led participants to feeling empowered both economically, socially, and intellectually with increased professional self-worth. So to give you the big picture here is that strong midwifery associations are a sustainable mechanism to improving gender equity and reducing maternal and newborn mortality and morbidity.
So let's hear from the participants themselves. On gender equity, once you build a strong association, then that association is going to keep advocating for its members. It's going to keep advocating for the profession. It's going to keep advocating for women and children and their rights. On supporting quality care, it used to be the doctor who trained others in EMONC, which is emergency skills training. And now it is the midwives who are called by the government. Midwifery trainers have been able to advocate for the presence of midwives in EMONC trainings and even to include traditional birth attendants in rural areas. On building sustainable midwifery associations, the Midwifery Association, are constantly building that capacity. And another good example of, and this is actually a success story for that, is that they are building the capacity to write proposals. So now they get funding directly. We have a local fund and now they have funding.
Okay, let's get into the policy brief itself and a figure that's in there. So here we present to you the core concepts and theory generated from our research on the components of sustainable midwifery association buildings. So look at these circles and thinking of them as representing key considerations by level required to sustain midwifery associations. Starting in the center at the micro level, this represents the values that guide the work and outputs of the association. Examples of our data were social justice, gender equity, and anti-oppression as those values underpinning midwifery associations. These core values interact at the meso level to influence the organizational and technical capacity of the organization. And then finally, when you look at that outer system, the macro level, it recognizes the institutional context and the external factors that either would enable or constrain the influence or the influence of the association's actions. So the stronger the association's capacity, the less constrained they are in this context.
So very practically, what does this actually mean for you or midwifery associations? Any programming or any capacity building needs to be undertaken, that is undertaken by midwifery associations, needs to take the context or these components into consideration. So to remember that strengthening and building capacity of midwifery associations is both a political and technical process that is shaped by the individual country context or regional context, reflecting the country's different political, economic, and social characteristics.
Now, the last important note on this slide is gender and the role of gender in society. It's this inseparable component, and you'll see that it cross-cuts every single one of these concepts and every single one of these levels. So the social construction of gender and the status of women and girls impact the value placed on women in society, and in turn, the value placed on predominantly women-led midwifery associations. So conversely, midwifery associations can be an opportunistic space for women to develop leadership skills and to increase their visibility and capacity within health and political systems.
Okay, so this is a really, really busy slide, but this is one of the links that we have sent to you that has open access. So it's a public free resource, and it will be available in French as well. So we just discussed with you a very conceptual understanding of the components for sustainable midwifery association building, but our goal, especially working with CAM, was to translate the evidence into practical tools for midwifery associations. So to the left of the slide, you will see a checklist for organizational capacity. So organizational capacity is the ability of a midwifery association to have sustained capacity to operate as an organization effectively and efficiently. On the right is the technical capacity, which can be thought of more as the core business of the association. It refers to their ability to have the technical capacity to support and maintain effective programming and activities. So we found that the reciprocal relationship of the two was really revealed in our qualitative evidence.
So what we found in our results was that when midwifery associations housed programs to increase in-service midwifery capacity, such as emergency skills training, both the organizational and the technical capacity of the association was increased. To effectively deliver EMONC training, associations were trained in both the programmatic and administrative skills and team building. So these skills were then generalizable and transferable to efficiently running the association. So in-service training was also identified as a way to raise associations' profiles within facilities, hospitals, and health networks. It increased the visibility and credibility and assisted the association to effectively carry out activities. Think of this checklist, it can be used as a way to assess an association's baseline capacity and to build activities, to build input indicators, as well as outcomes. And it really is this guide, we're hoping it's this guide for how to approach project activities, as well as how to measure immediate outcomes.
So this is a type of illustration that might or might not be familiar with you. It's mostly familiar to people that manage projects or people within CAM, for example, that are building activities, and it's called a logic model. So using the results of our research, we developed this logic model for midwifery association capacity building. It's available in our policy brief. And again, in really simply put, it's a pathway. So again, it's looking at building capacity of the association. So you have a sustainable midwifery association, and what are the inputs, activities, and then outcomes you're looking for to build that midwifery association. So just really briefly, some examples of inputs, which is on the far left hand of the slide, which is where you start. So the inputs of your activities that will strengthen the midwifery association include equitable partnerships. So that we were talking, that Astrid was referring to before in the beginning with CAM, in their equitable partnerships that they seek to have with midwifery associations around the world. They're required to mitigate power imbalances between visitors or contributing funders and host midwifery associations. So equitable collaboration is a process of knowledge construction and sharing that requires equal partnership in order to properly function. So it's a really important input to midwifery association strengthening. Certain activities and then their outcomes of the activities for capacity must both be considered. So the level of attention provided to them and specific focus will emerge from the baseline assessment and the initial discussions between the visiting funder and host midwifery association. So the checklist from the previous slide provides a guide on how to approach project activities, as well as how to measure immediate outcomes. So for example, you might have seen something on the checklist related to governance or to having proper infrastructure of the association, etc. Intermediate and long-term outcomes on the far right hand of the slide are based both on the organizational and technical capacity of the Midwifery Association. So the point there is their ability to sustain capacity in both ultimately, so their ability to function as an organization itself and their ability to effectively run their activities, both ultimately demonstrates the ability to achieve organizational aims or missions, which are likely parallel to project objectives and aims regarding meeting the SDGs by 2030. So here we're presenting our core recommendations to Global Affairs Canada based on our research findings, but we decided to keep them up today because we believe the elements of these policy recommendations are applicable to other contexts in terms of associations or jurisdictions in which associations are working, where they want to be able to strengthen their capacity, but they need to lobby with governments or other funders even to be able to get the collaborations and partnerships and support to become stronger associations and to be more effective in their work. So the first recommendation is to ensure that midwifery associations are central and properly embedded in any projects or any sort of undertaking or program that works to strengthen the midwifery profession and promote access to SRHR. The midwives need to be in all of those projects, at all of those tables. This includes capacity building of the Midwifery Association and housing activities facilitated by midwifery associations. So what we mean by that is if you're going to include midwifery associations in programs and projects, you need to make sure that you're supporting them to be sustainable after those projects are done or to continue on themselves as midwifery associations, autonomous midwifery associations. So our research showed that capacity building of midwifery associations combined with continuing education activities. So the one we know mostly and what we see around the world is emergency skills training. When they're housed and facilitated by midwifery associations, this directly impacts maternal mortality and morbidity post-project. Number two, so the FIAP is actually, just so you all know, is Canada's Feminist International Assistance Policy. So we recommended to them to expand their action areas within the FIAP, their action area key performance indicators, to include a broader set of indicators that more fully capture the impacts of midwifery association-led skills training. So what we were essentially doing is helping them understand exactly how to measure strengthening of midwifery capacity in their indicators based on our research findings. So expansions include indicators that capture the who, what, and where of training and how this increases the capacity of the association. So our research found that project indicators, when midwifery associations were funded, were often limited to focus on like attendance or number of trainees. So we were just trying to get GAC or Global Affairs Canada to think a little bit more about how they could capture how midwifery association capacity is increased, how it actually impacts gender equality, how it impacts the number of women in leadership roles, and the overall integration of midwives at systems levels.
Our third recommendation would focus on incorporating equity and feminist frameworks for program implementation and evaluation approaches that promote equity and challenge power imbalances. Our research showed that a feminist, collaborative, and decolonizing approach to midwifery association strengthening resulted in reciprocal relationships, which built the trust and motivation of midwifery associations and resulted in empowerment and ownership of activities.
Okay, number 4 is gender again. So a gender lens is critical to capacity building of midwifery associations, including understanding the impacts of ethnicity and race. So all of the intersecting factors with gender. Establishing a base capacity of midwifery associations and outlining the limitations of those associations based on gender inequity and other intersects all support an equitable and feminist approach. So our research demonstrates that gender inequity impacts midwifery associations and midwives in unique contextually specific ways. So for example, often women midwives are often family caretakers and sole breadwinners, yet volunteering their time for projects and activities. However, when midwifery associations are properly invested in, they provide leadership opportunities for women to advance themselves professionally. And then finally, increase support for midwifery associations to actively engage in program implementation. So involve them again. National midwifery associations or regional require appropriate financial support with technical expertise to gain practical experience in project design and implementation to grow. So our research identified barriers in current funding models that often stipulate midwifery associations as beneficiaries instead of actual implementation partners, which may undermine the complex nature of organizational capacity building.
All right. So here are the next steps, which we are thrilled to be carrying out and very invested in this research, of course. CAM has invested in building the research evidence around their work, and they've been able to demonstrate that midwifery association strengthening is a sustainable approach to strengthening midwifery as a profession. And we really look forward to these next steps, which we're happy to report are currently underway. And that is to work with CAM and work with GAC to build midwifery specific indicators for capacity building of midwifery associations and more broadly civil society organizations, women-led ones in particular. And really we're moving to supporting midwifery associations to use our checklist, to implement them, to test the framework, to test our concepts, see if there needs to be revisions and tweaks. And we are so excited. We've just begun our newly funded research with MITAX and CAM. And this is an extension of this research. We are now going to be conducting a multiple case study in 4 diverse country contexts to actually apply our framework and our checklist. So we're looking at a few provinces in Canada, the DRC, in Somalia and Haiti to explore again this appropriateness and responsiveness of our framework and checklist. And on this final slide, as we wrap up, we wanted to acknowledge our funders for the policy brief side of things. So this was, as we mentioned, produced with the International Policy Ideas Challenge through Global Affairs Canada, as well as Social Sciences and Humanities Research Council of Canada, SSHRC, and the Government of Canada. And the views expressed in our presentation and the policy brief are those of us, the authors, and should not be taken to represent the views of Global Affairs Canada. So thank you so much for listening, for your time. And we're really hoping that what we can do with the rest of the session is have some lively discussion around midwifery association strengthening.
Yes, absolutely. Thank you, Kirsty and Christina. Thank you very much for sharing these findings of the research, and as well as a framework that you have developed to analyze the strengthening process of midwifery associations. It's of course, very relevant to the work that CAM is doing. Now we can open the floor to some questions, which you can send to us using the chat box. So I have a few already. The first question that I had here is, are your findings applicable to new and or small midwifery associations? If so, where is a good place to start? Who would like to answer that one?
Do you want me to take this one?
Sure.
Well, we can both. We can both
always
answer.
do anyways.
So in theory, yes. So theoretically, we proposed in our original research that this type of work would be applicable to all midwifery associations at various levels of their evolution. And if you look at, we didn't get the chance to talk a little bit about the context of each midwifery association that we included originally in our studies, but if you look at them, they're at various, they were at various phases in their evolution. So really quickly, Tanzania, for example, very well developed large midwifery association, whereas South Sudan, not so much. Haiti is in a long-standing midwifery association, but really almost faded away to not exist at all, and now is regrowing themselves again. So every single context that we used when we were creating our framework, we were trying to take those into context. We get to now take our research and go to midwifery associations that are really small, like in some contexts in Canada, just a few members, a handful of members, to really large ones. And what we need to tease out is when you're looking at these checklists and you see all these things in front of you, you're probably thinking as a small midwifery association, like, where are we even going to begin? And one of the things we wanted to tease out in our next research in terms of how appropriate it is like, how do we help smaller associations decide what to prioritize? And is that going to be probably based on your context and what your needs are and what your needs are your membership? Probably.
Okay, anything to add, Christina? No?
No, I think it's just that I'm really curious. My head is exactly where yours is, Kirsty, in terms of taking the checklist, especially when it comes to smaller or new associations, and almost doing a priority setting exercise or values exercise around there to see, because I theoretically think that some concepts in some of these areas are going to be more important to address and almost hierarchical, like I've said before. And I think that would be really interesting to study further. And I think it's going to be very dependent on the context and on the individual association itself.
Okay. There's another question here. What about civil society organizations? Can your work be applied more broadly?
You can answer that one.
We'd say yes. But I think we're also open to debate on this one and have debated it a lot, particularly with more of, I think that the debate is whether you can really, these findings about midwifery associations, or an argument saying that midwifery associations are unique and that it's not applicable to more kind of these broader conceptualizations of civil society. I think Kirsty and I stand the same, thinking that some of these concepts are more universal, especially if we caveat it within women-led civil society organizations, that there are features like understanding that MAs are unique because you are a health profession because of a number of different factors. But then I think thinking more broadly in terms of women-led civil society, I do think that some of the challenges and some of the barriers are more universal and could be absolutely addressed by some of the issues that we've talked about.
Mm-hmm. And just to add to that, if you're thinking about how, often if you're looking at this in terms of projects that are funding women-led civil society, is that I think the roadmap is there to understand why we need to support organizational capacity. So it's almost like what's seen is like, yeah, we want to support civil society and we want to support midwifery associations. And we want you to do really good in your activities, but we don't want to pay for your organizational capacity. We don't want to pay for your infrastructure. And for those of you that are involved in the way programs are funded more globally, or I would say even arguably locally, is that you can find money to run your activities, but you can't find money for infrastructure like computers, or, in some cases, in some of our associations, it's like a safe place to even function because of the threats of security and conflict. So what we're providing is just if we feel like that piece is applicable, like if you're going to support civil society to run these activities and talk about how they're impacting the public's view on gender equity or whatever their activities are, then you have to support their organization. And then you also have to look at how by supporting the organization, you're actually promoting women-led leadership and all of the pieces that we were talking about. So it is applicable for those reasons in broader senses.
Okay, there's a reaction here that I can read to you, and because it also has like a question at the end. So thank you for your powerful presentation. I understand that your research was conducted with professional associations involved in projects supported by external funders. Although it might be too early to say, what major challenges will these associations face when the project support ends?
That's a great question. So we definitely when we were doing our data collection, some of these, again, we tried to pick associations that were at different points in their projects. So Tama in Tanzania, for example, many of their projects had finished or just finished, and DRC at that point was at the very, very end point. And so a lot of our questions were around how they were able to sustain and what they needed to be able to sustain past projects. And this is where we found that the way projects were designed, we were hypothesizing, like based on what our findings were, that they were sustainable post-project. So a really good example, I guess we can't really give you like specific examples of associations, but midwifery associations that had very little capacity already at the end of projects were creating proposals to get grant funding, or they had because they had housed their own emergency skills. What we found almost universally with those associations is that they were actually marketing their ability to provide those trainings as a way to sustain the midwifery association. So within those projects, they had already found ways to be able to sustain themselves, although they still identified certain gap areas, which were mostly more around organizational capacity. They understood really well how to effectively run their activities, but they needed more support on organizational capacity longer term. And what that meant for them was they needed to be able to know where the proposals were and how to be able to access them themselves and apply for them. So not that they necessarily needed someone to come in and do it for them, but they just needed a bit more support to be able to apply for proposals and to continue on with their work to get the funding to do it.
Okay, there's more questions, so let me go through them. Will your framework offer support on what types of data MAs can collect for their outcomes evaluation?
I think that's another great question. So I would point you to the policy brief, because I think that's where you'll get more kind of the practical recommendations. So what Kirsty and I highlighted very superficially in the presentation, you can dive into more further within the policy brief itself, but we make actual recommendations in terms of the kind of data that midwifery associations, again, it's going to be context specific, right? But for those outcome evals, what we found a lot when we were in data collection was a lot of these indicators were superficial, but also not because of the association's fault, but rather driven by the funding agency in terms of what the funders want to know. We refer to it a lot as bean counting, just saying, okay, we want to know how many people attended a skills training versus more detailed or helpful information to know. So we make a lot of recommendations around that in what kind of indicators and outcome evals will be more appropriate.
Yeah, and just to add to that as well, I think one of the areas midwifery associations struggle is like they need to be everything in the beginning, right? Especially in the beginning, they need to be everything. They need to be they're mostly volunteers. And then in addition, they need to be able to like monitor and evaluate appropriately. And so part of what we want to take into the next phase is to help understand like what are the basic ways that we can integrate monitoring and evaluation, like associations can integrate those very simple skills in the beginning and skills build around it so they can keep track of their own progress. Because it's almost impossible to do when you're volunteering your time and you're just focusing on your activities. But then when you need to go and justify and prove that you're worthy of more funding, you don't have that. So it's like a chicken and the egg thing. So I think that one of the things we also talk about is why it's important for midwifery associations from the get-go to find really simple ways of integrating that into their activities and into their process.
Okay, there's also a question about the selection criteria for African countries.
I love this question. Can I start?
Yeah, are you going to talk about the CIS or with our projects?
I think with this research.
Mm-hmm. I love this question for a number of reasons, but I think it ties very deeply to Kirsty's and my approach in terms of our approach to research. So when we say that we are feminist, collaborative, intersectional, anti-colonial approaches and so on and blah, blah, blah to research, we really do mean it. And in one important way is just in terms of the selection. So whether it comes from the research question itself or the selection of the countries, it's not driven by us. I hope Astrid can attest to it now as we're kicking off on the second round of research, is that it is very much driven by the association through CAM's relationships, through CAM's twinning, and through approaching and having members coming forth and wanting to be a part of the research. So it's not based on our own selection criteria.
Mm-hmm. And I should also just add too, is that with the critical interpretive synthesis, when you're doing a synthesis review, you have to set, we had to decide what our search criteria was. And because many of CAM's projects are within sub-Saharan, we decided to make that our search criteria. So when we were doing when we were looking for the actual articles, that was our search criteria, was sub-Saharan specifically. You're like, no. Yes, it was.
No, you're thinking of the other one. I'm sorry. We have a number of research studies in skills transfer. For skills transfer.
Oh, for skills transfer, we did. That's right. But for this one,
midwifery,
for Midwifery Association, we kept it super broad and right. So I'm like just about to go back on what I said. So we have another research that we focus on sub-Saharan. But when we came to Midwifery Association Strengthening, actually, this is a really important difference, is that we had to go completely global because there's like virtually nothing on Midwifery Association Strengthening or Professional Association Strengthening. Really the only people that are putting stuff out is actually, because I see someone from SOGC, is SOGC, FIGO, and a little bit of ICM and CAM. So there was very, very little. So this is a substantial add to that sparse literature.
Okay, I see another question. How can we use this work to help advocate for midwifery associations to local governments?
This is a big
one.
This
was actually our goal in doing the GAC policy brief. So to be able to win this award was also to be able to test the waters and like think about how midwifery associations can get the attention of governments, because this is the whole point, right? Also, it's a really good question that I don't think any of us have an answer for, but what we do know about this research is that we feel like it's a tool that midwifery associations can use if they decide that some of their advocacy activities is to get in on government agendas or to get noticed within government agendas. So I think that's what we were talking about before with the political systems and ideas, interests, like to really be able to get yourself noticed, you need evidence, especially lately. It seems to be talking. And so if you can build the evidence and use this evidence to be able to like substantiate your position. I don't know, Christina, if you have anything to add around that.
I think it's so tough. I think our aim has always been to be able to start the conversation by giving high quality evidence. So by taking systematic review processes and then taking it with, usually people will just say, okay, the systematic review is off on its own and that should stand by itself. No, we then collected 5 other types of qualitative data to have really, and CAM open themselves up to us as independent researchers. So to have that robust evidence, I hope that something like our policy brief can take the tools and use them as a way to, what we saw time and time again in our research was that associations are having to do this work off the side of their desk because they're not getting funding for the association itself, for the organizational capacity, right? Activities, that's easy to sell, no problem, get a check for that. But when it comes to financing and administration and those core organizational and having the policies, the internal policies, the membership, all those pieces, there isn't an investment there. So I'm hoping that what our research can do is at least open that conversation and give some evidence to say, this is a worthy investment on its own and feeds into the sustainability piece. So 7 years after project, you have a project for 7 years after that funding ends. Well, guess what? Now the association has that organizational capacity, has the ability to write their own proposals, has the networks, the policy networks we talk about, and the communication strategy, and all those different considerations, that they now have, that broader skill set to have more diverse funding and that longevity piece and sustainability.
And then if I can just add one final thought on that, I think our research paper is really useful because it provides evidence. It says midwifery associations, when properly supported, can do X. And so again, it gives a really clear, like you can create that into like a really quick, easy, readable, accessible, very short policy brief for governments. And it supports your stance as an important lobbyer and an important collaborator with your government.
Excellent. Well, I think there's only one last comment, so I'm going to read it to you. It's in French. Présentation fantastique, Cristna and Kirsty. Merci pour tout ce que vous faites pour aider les sages-femmes, les droits et la santé reproductive. So that was the last comment. I think that we are going to end this session here. We are going to send you the policy brief by email. And if you have other questions, you can also reach out to us, and I'm sure that we will find the answers to write back to you.